welcome back to our second episode of our podcast, Chiro Chat podcast. I'm Dr. Kelvin. I'm the clinic director of Family Health Chiropractic Clinic.
Dr. Ashley, Doctor of Chiropractic here.
So today we decided to focus on the recovery after the Senchart Marathon. So how was your marathon?
It was a good effort, but it's a tough effort, right? I think Dr. Kelvin can account for that because he's been at the 2012 Standard Chartered Marathon when I came in first local, and I won the first local then, but I looked totally smashed at the end. I still have some photos of that moment somewhere. Yeah. So I think it's great that runners pushed hard, hopefully safely across the finish line. It's just now what's next. You've crossed that finish line, so what's next? Right?
Yeah. So what do you have any advice for the viewers? What they should do at this point? They have been pounding their feet and their joints over 42 kilometers, or maybe for some 10 kilometers, 21 kilometers, and you did the 42. And do you have any advice for them as a seasoned runner like you
are? For me, the hands of the chiropractor are always the last on my spine and before the race, and the first on my spine after the race. Here's what I mean. Okay, so before the race, I do go for my sport massage therapy, but I get my chiropractic alignment just after that. So literally just before the race, as close to the race start as possible, I get my alignment done. Now after the race, Dr. Kelvin mentioned about the pounding that your joints take, not just the knees. Ankles will reverberate up the whole spine to the pelvis. Yeah. So there is a chance that there could be some misalignments, somewhere in the whole neuromuscular chain, right? So for me as a runner, my priority is to make sure we get those seemingly small misalignments sorted out before they escalate, right? Because there's a good chance if you're a runner like me, no matter how much you've suffered at the finish line, right, you're already thinking about the next race. Yeah, I know a lot of you runners out there, you've already planned your next 1 or 2 marathons ahead. So I think it's important if you want to safely start your next marathon cycle, you need to have a solid foundation first.
Yeah. Is that correct? Yeah. I mean, it's quite interesting you mentioned that, like, this race and what's next, the next race is coming up, right?
Yeah.
It just reminds me of the F1 race. I always visualize marathon, Senchart Marathon, somewhat similar to an F1 race because of all the buzz and everybody's getting so excited. But more so, as runners, you prepare so much, you spend so much efforts to get yourself ready for the race, and then imagine all the training that you've done, all the therapy, all the adjustments, then you go for this big race. Then after the race, what happens next? For an F1 circuit, I mean, the whole event, after the race, the car goes back to mechanic, and then they reshape. I mean, they study what get all the wear and tear, and then they basically prepare the car again for the next race. Yeah. Similar to a marathon runner, or maybe you may be running a shorter distance where you, after all the pounding, would it not be a good advice for you to come back? I mean, to see a chiropractor to get a spine checked. I know you are a classic example. You have been doing it for so many years, like pre-race, post-race, and that's very important.
Yeah. Interesting you brought up the F1 analogy, because I was invited to the F1 last year, about in 2024, to be a chiropractor on site. So I did get to see these cars in action, and it made me think in person as well at the event. The amount of recalibration that's needed after such a tough, demanding race as F1. Even more so for our own bodies, right? We need to invest our own spines and our own health and alignment, because it sets you up for the next stage. Yeah.
But sadly, we don't see a lot of runners coming in for a spine adjustment after a race, and then they will hop on to the next race, and then just imagine the pounding that they have. Like, maybe they get some form of micro trauma or injury to the joints, and then without getting it sorted out, they go for the next one. So that sets them up for some form of injury later on.
Yeah. So that getting that recalibration in, preferably as soon after the race. But speaking of the timeline, what do you think in your experience is a good timeline for someone to potentially come in for a chiropractic alignment post-race?
I having seen your experience, I know for the first few days you'll be so sore, and usually getting up and down the stairs is quite difficult, right? Even getting up from a seat. So I would say as soon as it's safe and you're comfortable to get into a clinic to get a spine check, probably within a week or so, yeah, you might want to come in for a spine check to see how things are lined up.
Hmm.
Yeah.
Yeah, I would agree to that. I've been adjusted since 2010, right? That's usually my protocol. It's very normal to be very sore in the quads, glutes. Even for myself, look, even the Kenyan runners, right? After a race, they'll be walking a bit funny down the stairs, and that's the good kind of pain, if I can broadly classify it as such. But what we should not be expecting is the bad kind of pain. So again, this bit of this distinction between good pain and bad pain. If there's any hint of any bad pain, like sharp pain in the knees or any jolts in the spine, then all the more priority, right, to
exactly.
come in ASAP.
Exactly.
But yeah, how the whole recovery timeline kicks in. I know a lot of us may want to go for a sport massage. Uh, in my experience, I mean, may work differently for different people, but in my experience, after a grueling race where there's a lot of pounding, there's definitely some micro trauma to the muscles and soft tissue. So I feel that instead of like rushing immediately after you cross the finish line to get that massage, especially a heart massage in, you just give it a little bit of time and space to breathe first. So if I could prioritize, I would do the chiropractic alignment first, and then when the muscles are more loose and more normal, you're not limping down the stairs because of your aches and all that, then that's where you could go for your massage, gentle massage, not too intense, if that's something that could work for you.
Yeah, I think that makes sense because you get the alignment set in and then you work on the soft tissue.
Right?
Yeah.
Sure. Yeah.
Okay. And so I noticed that some runners, they are concerned about having to get on the adjustment table because when they're so sore, right? Yeah. And maybe you want to share with the viewers how different it is when you got the adjustment.
Right. In terms of what happens in the clinic, right?
Yeah.
So in our chiropractic clinic, when we take care of runners, including runners after the Standard Chartered Singapore Marathon, typically we'll do the vast majority of checking and adjusting in a seated and standing position. So if you're having difficulty getting up and down from the bed, you don't even need to do that. Yeah, saves you a lot of effort. But it's specific, right? Because when you're running, you will clearly in a gravity dependent situation. So likewise, when you do the post-race check.
I think we prefer to adjust runners in the standing or seated position because that's where the spine and the spinal disc takes on the most pressure versus if you're to be lying down.
True that.
So I think that works very well for you.
Yeah. Since 2010, we've been adjusted. And no overtraining injuries since. So.
That's great. That's great. So do you have any parting words for our viewers?
You've run a hard race, so give yourself a pat on the back. But speaking of your back, it's good to give yourself a spine check as well. As we mentioned just now, it's so important to recalibrate the whole system. Your body's so interconnected, so any small imbalances, they do need to be looked into, sorted out post-race, so they can set you up nicely for the next stage. Then another parting advice would be, some words of wisdom right here. Injuries do not have to be part and parcel of sports, even at the high-level competitive levels. I've been fortunate not to sustain any overtraining injuries since 2010. It's what we mentioned on the earlier podcast, and I believe that can be potentially applied to you, the readers, the viewers, the runners out there. As runners, we're always trying to bring our A game, right? Instead of just for our A game, it's not just reacting up to situations or injuries, but if we can do a preventive, proactive approach to prevent those injuries, so you can train for your next marathon, your next competition with peace of mind.
Yeah, I think what you brought up a good point, and you have been so consistent with taking care of taking care of your spine pre and post race. And I think we mentioned we use the F1 example. Basically, chiropractors are just like the spine mechanic. So after a race, we want to check out the whole spine structure to make sure it's well, so that you can go on for your next race. Yeah.
All right.
Right. So that's the end of our second episode of our podcast. We'll see you again soon. Bye.
See you at the next Chiro Chat.